When we meet at the Private Healthcare Summit on June the 13th, I'm going to tell you how you can grow your revenue, work more efficiently, improve your profitability, lift staff engagement and retention, improve collaboration across your teams, and in a win-win, also improve health outcomes for your patients. And I'm going to do all of that in just under 20 minutes. Unfortunately, it's not a magic formula that I can dispense in a pill form, but rather it's a proven business strategy that many companies outside the health sector are now embracing with measurable success. My name is Mary Vance and I'm the co-founder of Simplicity. The CEM of Simplicity stands for Customer Experience Management, and this is what we'll be discussing. So what exactly is CEM? During my presentation at the summit, I'll outline the systematic and strategic approach to optimising customer experiences that has become the field of CEM, and you'll notice I'm not using the term PREMS or patient experience. Of course, your customers are often patients, and PREMS and CEM are closely related. However, for the time I have with you at the summit, I want us to focus on the commercial outcomes that can be achieved by a well-designed CEM program. My view, which I hope to convince you of, is that this deserves as much attention by the board and senior leadership team as your financial metrics. Well, what the Simplicity team has seen across the 6 countries we work in, but particularly in the UK, is that the commercial benefits aren't really realised through the way many organisations are approaching PREMS. So I'm going to start my presentation at the summit by sharing some evidence from outside the health sector. You may have noticed that companies like Amazon, Apple, big banks, telco companies, etc., they now often describe themselves as being in the customer experience business, rather than online retailing, say, or consumer goods. And they do this because they know that they're only going to survive and prosper in their competitive marketplaces if they can provide consistently exceptional experiences for their customers. A recent McKinsey report states that across industries, successful projects for optimising this customer experience typically achieves 5 to 10% revenue growth, and at the same time cost reductions of 15 to 25%, just within 2 years of starting a good CEM program. And there's some great evidence within the health sector as well, so when we meet, we'll cover that. What I think is really important for health services, with the challenge we have of attracting and retaining staff, is the evidence that a well-designed PREMS or CEM program can also lead to more satisfied employees, better staff retention, and also improved organisational collaboration. So once we've talked about the evidence supporting the work that we do, much of my presentation will cover the essential features of a successful program. So those things you have to do to realise the commercial and patient benefits. And I think it'll be really interesting for you to compare my list of success factors against your current organisation's current approach to PREMS. So I hope to meet you on the 13th at the Private Healthcare Summit, and I'm really looking forward to some interesting conversations. Thank you.